My name is Charl Els and I'm a clinical professor in the Department of Psychiatry, and I'm appointed as a physician educator in the Division of Preventive Medicine, Department of Medicine at the University of Alberta. Today's session focuses on the Job Demand-Control Model, or Karasek's model. It's an influential model that's described as both practical and testable, and it's had a significant impact on occupational literature and thinking. This model is among the most widely used theoretical frameworks that relate characteristics of a job with health and well-being. Thank you to the Workers' Compensation Board of Alberta for making funding available for this project. There are no conflicts of interest to declare, and the opinions expressed in this presentation reflect those of the speaker and not necessarily those of any collaborator or project sponsor. This session provides a brief overview of the features of this demand control model and how it impacts occupational variables. So what exactly is the Job Demand Control Model? It was way back in 1979 that Robert Karasek published a model that has significantly contributed to our understanding of the mental health consequences of work and how it can be improved. It's done by considering two factors or dimensions in the work setting. And these dimensions are: one, the extensiveness of the demands. For example, how demanding the job is, or in other words, the workload. Job demands also can be seen as representing the psychological stressors in the work environment. And this would include things like pace, the number of interruptions, pressures, among others for time, presence of conflicting demands, required turnover or reaction time, pace of work. And this element also includes the amount of concentration that's typically required and the proportion of the job that's indeed of a particular demand. Secondly, the next factor in this model is how much control or discretion the particular worker has. This factor also is described as the amount of discretion or decision latitude or authority the particular worker has in order to meet specific job demands. In short, the second element speaks about the amount of control the person has over his or her work responsibilities. Decision authority describes both the worker's ability to make their own decisions about the job, as well as their ability to influence the team and circumstances under which they have to work. Research suggested that decision authority is more important than skill discretion. So by crossing these two dimensions, jobs and the associated stress levels are defined by their particular job demand control combinations. It creates four variants of jobs. 1, low latitude, high strain. 2, low latitude, low strain. 3, high latitude, high strain, and 4, high latitude, low strain. The high demand, low control model defines high stress, unhealthy jobs as those with low control and high demand conditions. Such high demand conditions speak about inadequate time to meet job demands, and it's associated with an excessive workload. Employees may not be given the leeway to make meaningful job-related decisions regarding their work or work environment. Also, there's limited opportunity for the worker to learn new skills on the job. In this model, when a worker experiences high levels of job demands but has little decision latitude, the worker would experience job strain. These are called high-strain jobs. This has been seen as consistent with a biological view of depression. Psychological stressors exert effects through the central and autonomic nervous system, and how these stressors are interpreted by anatomical structures like the hippocampus and the amygdala. When chronically occurring, such as in high-strain jobs, it can create an imbalance in the allostatic neurochemical systems, for example, the hypothalamic pituitary adrenal gland system. If unrestrained, this can result in physical illness, for example, cardiovascular disease, depressive illness, and several others. Similarly, when favorable, the model suggests that work may have a beneficial impact on this neuroendocrine axis. And it's not only high-strain jobs that can be hazardous to health, but also passive jobs. That is where there's low demand combined with low latitude. And the model suggests that this promotes job dissatisfaction and learned helplessness, which is also a feature associated with depression. A third option, the so-called low-strain job, that's where there's low demand but high latitude. The fourth is the so-called active job, and that's where there's high levels of demand combined with high levels of latitude. Under these circumstances, workers often report high levels of job satisfaction, as the position helps the worker realize his or her accomplishments, which are often repeated. The model's been subject to a number of research questions using both cognitive and epidemiological frameworks, and of great interest are the findings considering the proven beneficial impact of workplace supports on health and occupational outcomes. Certainly is a topic of ongoing empirical research and how it's integrated into broader models that capture other variables and theories. Workers are the most valuable asset of an organization. Job dissatisfaction and job-related factors increasing health risk warrant our attention. It is important to be aware of the interplay between job demands and control to actively measure where workers fall in these quadrants. The model provides a starting point for interventions, and there are steps that can be taken to transform high-strain and passive jobs to those that are more conducive to job satisfaction, better occupational outcomes, lower rates of absenteeism and burnout, and overall better health and psychological outcomes. Work generally is therapeutic, and persons generally do better when they work. This is provided there's a reasonably favorable balance in each of these factors of demand and control. So this job demand control model provides a valuable addition to our understanding that the mental health consequences of work can be improved by considering these factors at work. This interplay between demand and control has vast implications for outcomes, not only physical but also mental, and as suggested, it impacts satisfaction, absenteeism, presenteeism, overall quality of life, and it's even been linked to the risk of suicide. For the same token, it may exert a protective element or factor depending on what combination of demand and control is actually in place. For further information on additional sessions of this nature, please visit the website of the division. We do look forward to your feedback and comments, and please help us identify further topics for future discussion. Thank you.